Who is Juan Muro? Juan Muro is a guy currently 50 years old, a child, as I say, physiotherapist for 29 years. That finished his degree in '92, that enjoys his profession very much, and tries to improve day by day, to learn from everything around him, to help people in any he can't. And, well, as a person with a lot of ambition on a professional level looking forward to forming a team, to be with people, to enjoy life and that part of his life, physiotherapy is undoubtedly really important. And, well, as a person who matures day by day, a person who learns from mistakes, who tries to give the best of himself every day, that at least tries. Whether he succeeds is another matter, but above all, he tries. He is currently working as a physiotherapist in the Spanish national football team signed 2016. With a team of fantastic people, the entire medical service and all the technical equipment. And, well, I've been working there since 2016. I also had the great opportunity to be part of the physiotherapist team of the Croatian national team at the World Cup in France of the year '98, in which I had the great fortune to come third in the world. And then I have also had the good fortunate to be able to spend 19 seasons as physiotherapist at Real Madrid Football Club. So, well, it is true that although I also work on a private level, I have my own private practices privately. As Juan Muro Zabaleta, for 29 years I have been dedicated mainly to the elite sport of football. The knowledge of non-invasive neuromodulation NESA, I think it's spreading, well, as a therapeutic weapon, without doubt, in all physiotherapists who have been working for a long time and in the future conferences of physiotherapists, because we understand the approach, well, for years now, in a very global way, a very global concept, the autonomic nervous system, the great forgotten one. There is a lot of talk about the nervous system, and the central nervous system, the peripheral nervous system, is spoken of as an entity that needs to be assessed, to evaluate and to treat. But within the nervous system there is an autonomic nervous system. What is physiology? And what is really relevant and important in our daily clinical activity? Patients, their evaluation, treatment and therefore knowledge, the science behind NESA, behind neurostimulation non-invasive NESA, is fundamental. And I see it, that is to say, I see it ascertaining. I've been using this technology 2.5 years. And I see that not year after year, month after month, that is, the number of students, the number of professionals, the number of physiotherapists, the number of clinics that are joining not to this project, but to this knowledge, to this great knowledge that helps us so much in our day-to-day life. I see it, come on, I don't know what to tell you, but in 5, in 10 years, in 15 years, or in 20 years, practically, I believe that every physiotherapist, every clinic, is going to have or is going to be at its own provision of an X signal to be able to attend in a complete way, in a global way to all outpatients. Without a doubt, NesaWorld is already making us understand, from a clinical point of view, the integrative treatment. That is to say, today as we are, to understand a patient only from one point of view, from a therapeutic approach, does not make sense. Physiotherapy has evolved. Medicine has evolved towards an integrative concept and what it means to know how to close that circle. Without a doubt, since I've known the technology, what really caught my attention is that it really covered that missing need approaching the autonomic nervous system. And the fact is that we are physiology, we are electricity, we are emotions, biochemistry. And there, no doubt, the stimulation NESA with its X-signal device has undoubtedly a great added value. And it is the one that is helping in a spectacular way, in a way I repeat again, to make an integrative treatment without wanting to be the great added value it should be, in the sense that it is better than the other types of therapy. It comes to add, it comes to integrate, come to all of us who work in the clinic field, to possess a therapeutic tool of great added value. Success is, certainly as a clinician, helping my patients to have a full practice every day, on a personal level, enjoying my work, the one whose alarm clock goes off at 6 a.m. and I got up eagerly to go to work. For me that's success. Success is getting up from defeats, is knowing how to suffer, to know how to have fun when there's fun, and know how to pick up the pick and shovel when it needs to be done. And understand that success, let's say, it is achieved on the basis of work, on the basis of suffering, by being a good person and wanting to share your knowledge, your way of being with the rest of the people.